Thank you, Claire. But also thank you, Sonia, Ruth, and Nicola, for sharing your reflections. And I hope you will all agree that those 4 presentations have given us some really useful insights and given us something further to think about in terms of using the framework. And we've actually caught up on time that we'd lost earlier. So this is the chance that there's an opportunity for questions. So really, it's over to you. What questions have you got? What would you like to ask of any of the presentations this morning? Fiona.
Thank you, Michelle. I guess it was a question to Claire in terms of the transition that you've made down south from the Cube to the new framework. What's your thoughts? Nicola's referred to work that Glasgow and Clyde did in terms of staff becoming familiar with the Cube and the language, but there's a journey to go on in terms of moving people into that new refresh framework. What's your thoughts on that?
Sorry, that's my fault.
Now you can hear me. Transition from old to the new. I've not heard much about that, to be honest. Maybe the people who have struggled with that haven't told me, is all I can think. Is that so I mean I'm open to, challenge and question. This can't possibly be all good for everybody. It's quite a radical change. So I'm here to be all ears and to see how, as I say, I've talked about an iterative process and an agile development of this product, and we've got it to a place where we've tried to pare it back as much as possible to simplify it as much as we can. And it may grow over time, and it'll need another review possibly in a few years' time. But I haven't. And somebody's already mentioned today that they're using both at the same time. I did think about at some point that we might, for each of the 13 buckets that I was talking about, 13 areas, maybe we might want to articulate what the knowledge base requirement would be for each of those, which is a piece of work that we could do fairly quickly, to be honest. I mean, most universities could probably knock that up overnight. So, I mean, that is something that we can think about as an additional resource, because I do appreciate that the original framework had lots of descriptors about what you needed to know. Having said that, we did look at the knowledge descriptors, and a lot, as I mentioned earlier, it was an awareness of or an understanding of. That there wasn't a lot there around critical appraisal, and you didn't always see that necessarily the critical appraisal being nearer the top if it was there, or it was fairly haphazard. Also, there are other areas where what people should be able to do and know and exercise in terms of their knowledge base, they're described in other places. So, for example, the 9 levels, what people are expected to be able to demonstrate in terms of their activity at work. On the career framework, it's quite clear what they expect you to, they expect you to apply your knowledge base. But also, what's clear is that there's a qualifications framework, and you have your Scottish qualifications. I think you've got about 13 levels or something like that. We've got about 8 for England and Wales. I'm not quite sure what they've got in Scotland, but we have very clear qualification frameworks in our countries, and they write in quite a lot of depth what you're supposed to be able to do in relation to your knowledge base at different levels. Now, this is another set of levels. They're different from the career levels. They're different from the Agenda for Change levels, but there is about 8 of them, which just adds to the confusion. But, for example, level 6 is graduate level. So level 3 is A levels, level 2 is GCSE, or O levels if you're my age. But So there are lots of descriptors in other places if you want to get a real handle on the level. And this is what I've tried to capture in these indicative role templates that you have on the tables. Because there are other frameworks that actually describe the knowledge base better than the original framework did. And we need to be thinking about, if we're developing our workforce, we need to be better versed really in what the whole suite of tools are. Unless we're going to develop a framework that reflects what it says in the qualifications framework. And I'm sure that work was done originally, but a lot of these things have been quite refined since. You know, there's a lot of refinement that's gone on. And we have practitioner standards and specialist standards that have been developed and are now themselves being reviewed in the light of the framework. So both of those sets of descriptors are being revisited in the light of the framework. So hopefully there'll be a clearer read across. So I haven't answered the question, Fiona, really. But I have talked about a few other things. But I haven't had that. So maybe if there are a few of you in Scotland that have been quite wedded to the original framework. And I do actually remember when I first came in March 2015, particularly the environmental health people and at the university, they were probably the most, they used the framework most heavily, in fact, to develop their curricula.
Thank you, Claire. Question at the back.
Hi, it's not really a question, it's Heather Sloan here from NHS Greater Glasgow and Clyde. It's just to say that I've used both, and when I used the Cube it was quite challenging at times, but when I used the new framework we actually used it with health staff and non-NHS staff, as well as administrative staff, and they could actually see themselves within it, and I think it was a real ego boost to actually look at the framework and actually say, you know, I can be part of this, you know, I do play a role. And that was from right down to, you know, our support staff right up to our leads. So I think it's an actually a simpler way of looking at where you fit in within the wider public health workforce. When we used it with non-NHS staff, we felt it would be quite hostile because it's like, that's nothing to do with us, we're no health, we're counsellor, we're community staff. But actually when you explained it, it was an easier way to explain it, and they actually embraced it at the end of the sessions. So it's something that we are going to kind of roll out across, and we hope that it will be useful, particularly in the climate of integrated health and social care partnerships.
Well, that's really good to hear. Thank you, because I mean, you know, that we do have a big ask behind this framework, and that it is relevant to the core workforce, the wider workforce. It transcends all organisational boundaries, and it's relevant equally across 4 home nations. You know, there is a big ask behind the framework, and there was with the original one. So to see that it's you're able to use it to engage the wider workforce is really encouraging. Thank you.
I think also what you've described there is useful in terms of empowering the wider workforce as well. Yeah, thank you. Oh, right at the back as well.
I think it's brilliant. I think nobody's getting against the framework, and whether you're wedded to the old one or the new one, it's just fantastic to have a framework. The challenge for us is not just to have a framework that sits on the shelf or there's a few of us who use it. So we do need to, and we need to establish mechanisms by which we can explain to people, we can take people through what it means to them, and also establish processes by which they actually use it, so as part of appraisal systems. Because if we don't build all that in and embed it, and actually have the champions like Heather and Nicola and Claire and all of the people who've spoken today, it will just become something that sits on the shelf, and none of us in this room want that to be. So we need to make sure we've got the mechanisms in place, and as managers, we need to support that to happen.
Thank you. Yeah, and that's why I asked at the very beginning, put your hand up if you're a manager or a recruiting manager, because you're the ones that have to embrace it. You know, so that's how it gets implemented.
Hi, my name's Fiona Smith. I'm an academic and I work at the University of West of Scotland. I'm sorry, I don't know your name down there, but I think that's a really key point. I just did some work for the 2030 nursing vision, and I think the framework would be really, really helpful embedded into the actual, for the nurses working in the NHS, because they're worn out, they're frazzled, and they don't really know where their roles are going. So that would be a really good practical example of how, where the framework is really desperately needed.
Thank you for that.
So thanks for that.
Cool.
Sorry, can I just come? Sorry to keep butting in, but we're at
You may as well come up
PHE. The nurses within PHE, they're coming up for revalidation, so they've got a piece of software for the revalidation of nurses, and they've loaded the framework on, so that they can, align their revalidation credentials against the framework. So it's obviously had appeal with the community within PHE.
I think, Elaine, did you have a question? And I think there's one at the back as well after that.
Yeah, Elaine Young, Health Improvement, NHS Ayrshire and Arran. So I suppose I just wanted to make some links to the shared services review, and I was desperately trying to rack my brains to think what the 5 work streams are. So folk can tell me if I'm right or wrong, but health intelligence, I think there's something around knowledge services, health protection, immunisation, and is the 5th one workforce development? I'm looking at Anne Conacher, is that? Development, yes, and screening. So I suppose from hearing what Sonia was saying, there's obviously going to be a work stream that's going to be picking up the health intelligence and doing the audit, etc., and workforce will be part of that work stream. I would take it the same would be true of health protection. So I just wonder in terms of health improvement, because there's not actually a work stream around health improvement, if perhaps some of the workforce elements might get a wee bit lost in all of that. So I suppose what I'm saying is there's a focus perhaps in terms of some of the other dimensions, but perhaps not so much emphasis on health improvement through the shared services review. That's just my take on it. It could be absolutely wrong, but maybe there's somebody in the room who can shed some light on that.
Andrew, do you want to pick that up? Sorry, I've put you on the spot a bit. Anyone else offer?
Yeah, I think I'm not an expert in the shared services review, but I think we will be able to, both in that and the forthcoming national public health body, be able to pick up quite a few of the strands that have been raised this morning.
And actually, I'm also just thinking as the comments and questions are being made, I'm just wondering whether they're being captured somewhere so that we have them at a later stage to reflect on. Yeah, thank you. Can I come back to one at the back? I think it was Anna. Oh, sorry.
Thanks very much. Good physical activity going on in the background here. Anna Baxendale, Greater Glasgow and Clyde. And it's it's another question for Claire, I'm afraid, in terms of learning from down south. Have any of the role descriptors been translated into a common set of job descriptions? Because one of the criticisms we get across the public health workforce in Scotland is that people struggle to understand what it is we do, and the framework obviously helps us, but in terms of actually having a workforce with some further sense of coherence, I just wondered whether they've been translated at that level or...
Not yet, but that is the thinking behind the role template on your desk. So that's why it's called indicative, because clearly, and there'll be a little caveat on the bottom that, this will be subject to local application and interpretation. But the idea is that from that, if you wanted to write the job description for a health protection practitioner, that's an attempt has been made, generic, to try and give an idea of what that would look like. So the descriptors could be, this person will need to be able to put your framework descriptor in, and you could put a for example. So if there's something, if you want to make a specific illustration of how that would look in your team, you can do that. So you can qualify the descriptor within your job description, and that is what the examples are there for. So we haven't got there yet, but that's the thinking behind the development of that indicative template.
Great, thank you. Thanks.
Ruth?
Thank you. It was actually for clarification. I think the shared service review, the health protection part's around on call. I don't know if anybody else can verify that or not. My understanding it's specifically about on call, but that's my understanding. And immunisation is actually, my understanding again, is a separate piece of work that Scottish Government are doing around the whole immunisation service delivery, but I'm not sure that's one of these 5 strands of public health. I don't know if anybody else is involved in that, but that's certainly my understanding, is it's health protection on call, because health protection had a stock take that delivered quite recently, which is why that network came about that I showed you, and workforce is part of that. But maybe Andrew can, he's moving.
Andrew's
that's my understanding.
Ready microphone to respond.
That's true. it's just ill protection on call.
Yeah.
Things are in a bit of flux at the moment because we're about to see the emergence of moves to implement the public health review. So I think we're right about the work streams in the shared services portfolio, but other things will pop up now. Effective local partnerships being a work stream, I think that the Scottish Government envisages as well.
Thank you.
Thanks very much. I'm afraid it's another one for Claire. And first of all, can I say I came up in the lift with Claire this morning, and she was telling me yesterday when she was travelled it was her birthday. So thank you for giving up your birthday to come and share your learning with us today. Claire, all the way through this, and indeed all other speakers, has been the key theme is about collaboration. And you mentioned that, you know, the evaluation of the effectiveness of collaboration activity being key to that. How have you gone about that? Because that's such a wide aspect of it, but it's a very crucial aspect of the work that all of this involved.
Are you asking me how do I evaluate collaboration? I don't know. It came out as a necessary aspect of working collaboratively from the work that I did trying to articulate really in a separate section now that I'd extrapolated it from leadership. You know, how do you just describe collaborative working almost without a context, if you like, because the skill set within that, and hopefully you can see that within, if you've got the document where the framework is presented, there is a little grey box next. If you've got the framework document, there is a little grey box beneath in the published document that tries to qualify what each of the 13 buckets is about. And if we're not careful, we're going to go from the cubes to the buckets, aren't we? So I have to stop saying that. But the collaborative, working collaboratively across boundaries talks about the skill set, which is mainly interpersonal. It mainly revolves around interpersonal skills. So the work, the two key sources that I used to try and articulate the area around collaboration was a book by Rob Baggott that is about healthy public policy. He's at the De Montfort University in Leicester, and a guy called Paul Williams who's lectures on the MBA at Cardiff Met University that has a book about boundary spanners. And I picked that book up from a leadership and management collaborative in London across a lot of public sector organisations. The Centre, a group that runs leadership and management courses actually between the police, the fire service, health and social care and different organisations. And both of those talked about the need to be a little bit more reflective and analytical about our engagement with others and how effectively that's working. So in terms of having exercised that skill set myself, I haven't done it, but I might have done it. I might have done it in the top of my head, or I might have gone to a meeting and not gone back. I don't know, you know, but I suppose we vote with our feet with these things, don't we, often? But, you know, it's a lot of that area of work is open for development, I think, and you know, a lot of thought. And I think anybody here that's probably tried to do a portfolio for registration at practitioner or specialist level, and they ask you what, you know, to demonstrate your knowledge of working collaboratively, it's very hard. I mean, even if you've done a master's degree, there's not a lot of master's degrees out there spending much time on what collaborative working means and what the theory base is, and that's what I was looking for. You know, if I'm going to bring this section out and give it its own focus, what is the underpinning knowledge and theory base behind this? And it's quite difficult to find. But one important thing that seemed to be consistent is that collaborative working, we take it for granted, you know, it's often said that everything would be better if it was collaborative. Well, sometimes it can be expensive and ineffective, and we need to be mindful of that. So that's why that descriptor was put in. And we'll see how it goes, see how the universities map their courses to the new framework and see how are they going to deliver the knowledge base behind that particular area of the framework. I'd be interested to know.
Thank you. Gabe.
That's great, thanks. Another one for Claire, I'm afraid. Claire, I really loved your slide on the third sector and how they actually used the framework. I'm just wondering, see from down south, has any of the commissioning bodies thought or have they used the framework when they're commissioning third sector or other elements of the public health delivery?
Well, most of my practice I've carried out in what's now Kent, Surrey and Sussex, but a lot of it's been in Kent. The population of Kent is near 1.5 million, so it's half the population of Wales. It's the biggest county in England. We've got top-tier local authority, county council. We've got 12 districts and boroughs beneath that. There's several CCGs. You know, organisationally, the landscape is huge. So if you want to pull together a health and wellbeing board, you've got 13 councils before you've even thought about any other agencies. So this is a big area to manage. And when I started doing the Public Health Skills and Knowledge Framework, the Health and Wellbeing Board at Kent County Council had set up a workforce review group. And they asked me to come down and talk to them. And this was because of the health and social care integration. And they're still quoting the framework at the moment. They're not quite sure where to go the next step with it, but they wanted to use the framework. And again, like we're still talking today, this morning, actually, a lot about how the framework can help individuals. I showed the Soil Association slide about how an organisation is mapping itself. There are councils in England doing skills audits in their teams, so it's a team view or a service view. But what Kent County Council Workforce Development Group were looking at is how can they map the resource across the entire county in the context of health and social care. And what they were talking about was that the traditional roles are going, you know, they're very short of psychiatrists. They can't get them, you know. How can we get a skill mix around those services? How do we describe new jobs that are a bit from what used to be the NHS and a bit from what used to be the council? So they're looking at, we need to actually create new roles. So how do we do that with the framework? And interestingly, I'm probably not answering your question, Kay, but it's about, this is from a commissioning perspective, because what they would need to be doing under the Health and Wellbeing Board for the council is looking at how do we make sure we've got the right complement of skills to promote the public's health in Kent through the public sector organisations. And I'll mention STPs, which we've got emerging in England, but that is about bringing collaborative and joint commissioning in much bigger groups for local areas with a lot more collaboration, in fact. So that's the model that's moving forward. And I've recently had a call from Skills for Health, who've been commissioned to develop a competency framework for social care. And they're struggling because they're trying to do it more prescriptively with lots of levels, and they've stumbled across the Public Health Skills and Knowledge Framework, invited me to do a webinar with their team, and now they're thinking about modelling the social care skills and knowledge framework on the public health one, so we get one across the whole of health and social care. So I haven't gone back to Kent. I occasionally keep in touch and say, have you done anything with it yet? What are you thinking? But it's in their documentation and their minutes, so they're mindful of it, but we haven't made that next step. But that's probably on the biggest scale where I've seen the framework being used to look critically at what workforce resource there is. But that's its biggest application at the moment. But I would like to see it in being used to develop service specifications, perhaps. But I think there's potential for that, certainly if you're commissioning provider services. But I mean, I think there is an issue. I mean, this is what we're finding in commissioning in England. You know, you could have commissioners coming into public health departments in the councils from transport, then being asked to commission health check services. They don't know what they're buying, and you've got providers then who have got a completely different group of workers from who they started with. I wouldn't go so far as to say blind leading the blind, but you know, we do need to become much more conscious about in commissioning contracts that we're specific about the workforce competencies that we need to have, or that the providers need to have. And I'm hoping that the framework can support that, because you can't necessarily ask that everybody in their organisation is registered, for example. So the framework could be used to say, well, at the very least, we would expect your staff to be able to demonstrate these skill sets. So there's potential there, Gabe. Thanks.
Thank you. I think that has neatly brought us to lunchtime. So can I suggest that we move out of this room, you take the opportunity of thinking further, networking, use those soft skills that we all have and that were referred to earlier, to maximise and continue some of the reflection and discussion. There's lots coming through from those questions, and we want to keep building on that. So and I do want to thank everybody for their contribution this morning, and I'm looking forward to continuing this afternoon to get that energy level back up again. And we're back into this room at 2 o'clock. That'd be great. Thank you.